Hello, welcome to the Ohio Adult Allies on-demand learning event titled Introduction to Selecting Evidence-Based Strategies. This learning event is presented by the Ohio Adult Allies Training and Technical Assistance Team. My name is Holly Raffel and I will be facilitating today's learning event. The learning objective for today's event are for Ohio Adult Allies to be able to 1. Select a primary prevention strategy and elaborate on why the strategy is appropriate based upon the theory of change. 2. Differentiate between two CSEP strategies, prevention, education, and environmental. 3. Describe the four primary environmental strategies, community norms campaign, access and availability, media messaging, policy and enforcement. And 4. Identify criteria for selecting evidence-based strategies based upon intervening variables. In 2014, the Ohio Adult Allies Training and Technical Assistance Team began listening to and working with adult allies from across the state to articulate a goal for youth-led prevention in Ohio. After many discussions and iterations, there was consensus that the overarching goal for youth-led prevention in Ohio is that young people will collectively engage in a planning process to create and implement a strategic plan that uses evidence-based strategies to create community-level change. Today's learning event will focus on the selection of evidence-based strategies that young people can use to create change in their communities. There are many strategies to choose from. A quick internet search will reveal a lot of strategies with the right keywords. However, the trick for any youth-led program is to choose the right strategy at the right time that's grounded in evidence, culturally relevant, and sustainable. The strategic planning work that youth involved in youth-led programs do supports strategy selection by ensuring that young people select the strategy that best fits the local condition. That's the choosing the right strategy at the right time part of strategy selection. Today, we hope to go into detail about the types of prevention strategies out there and how young people can use them to create community change. This speaks to selecting a strategy that's grounded in evidence, culturally relevant, and sustainable. The Substance Abuse and Mental Health Service Administration Center for Substance Abuse Prevention, sometimes called SAMHSA-CSAP, details 6 prevention strategies. These prevention strategies are defined and described in the Code of Federal Regulations in March of 1993. The Code of Federal Regulations, called CFR in federal acronym speak, is the codification of the general and permanent rules and regulations, sometimes called administrative law, published in the Federal Register by the executive departments and agencies of the federal government of the United States. The strategies that you see on this slide, and that many of you have learned during SAPS or other such prevention trainings, originated from the Substance Abuse Prevention and Treatment Block Grant. The block grant's objective is to help plan, implement, and evaluate activities that prevent and treat substance abuse. The block grant is authorized by the Public Health Service Act. The Public Health Service Act required the Secretary of the U.S. Department of Health and Human Services to create regulations as a precondition to making funds available to states and other grantees under the block grant. This was published on March 31, 1993. SAMHSA's Center for Substance Abuse Treatment, in collaboration with the Center for Substance Abuse Prevention, administers this block grant. In the CFR, it details that states should develop and implement a comprehensive prevention program, which includes a broad array of prevention strategies directed at individuals who are not identified to be in need of treatment. The CFR explicated 6 prevention strategies and provided working definitions and examples. It has not been updated since 1993. The CFR details the following strategies that we will discuss today: environmental, prevention education, community-based process, information dissemination, problem identification and referral, and alternative activities. In addition to identifying an overarching goal of youth-led programs in Ohio, our ongoing work with Ohio Adult Allies, we came to the consensus on a working definition for the way Ohio conceptualizes youth-led programs. From this slide, you can see that in Ohio, youth-led programs are described as a community-based process, which is one of the 6 prevention strategies detailed in the CFR. The evidence that undergirds this community-based prevention process is twofold: the Youth Empowerment Conceptual Framework, created by Holden and her colleagues, and the Strategic Prevention Framework, or SPIF, created by SAMHSA. As such, youth-led programs in Ohio have become a vital part of what the CFR requires: a comprehensive prevention program which includes a broad array of prevention strategies directed at individuals not identified to be in need of treatment. To further unpack the CFR and the 6 prevention strategies, the Ohio Department of Mental Health and Addiction Services has published the Prevention Taxonomy, which can be found on the Ohio MOS website. In the Prevention Taxonomy, Ohio MOS has identified 2 strategies as having the greatest propensity to directly create individual and/or community change: environmental and prevention education. The remaining 4 strategies are conceptualized as supporting strategies, which makes sense. Youth-led programs and coalitions are both examples of the community-based process strategy. You can have the highest functioning youth-led program and community coalition, yet they could never create individual or community change unless they implement one of the other strategies. Let's say a youth-led program selects and implements a media campaign. In this example, the community-based process is the indirect prevention strategy, and the media campaign is the environmental strategy that causes direct individual and/or community change. In youth-led programming, we use the community-based process strategy to select and implement another type of strategy, typically environmental, that will cause community-level change. The outcomes-based planning model that we use in Ohio is the Strategic Prevention Framework, or SPIF. This arrow depicts a logic chain, or theory of change, that is associated with the planning phase of the SPIF. Once the problem statement and intervening variables are selected, the short-term outcomes and long-term outcomes are clear. As discussed in our other adult ally learning opportunities, the problem statement and long-term outcomes are linked, and the intervening variables and the short-term outcomes are linked. We have also discussed how the evidence-based strategies that we select need to be directly related to the intervening variables we are interested in changing, which brings us to where we are in this learning opportunity. How do we select that evidence-based strategy? To review, the youth-led program in and of itself is a community-based process. So we are looking to build off of that community-based process to add another strategy. Generally speaking, when we are using our precious prevention dollars to implement strategies, we often look at choosing between an individual or environmental strategy. This is because these 2 strategies have the greatest propensity for individual and/or community change. If our goal is to change individual behaviors in a setting with personal interaction, then our best choice is prevention education. If our goal is to change individual behaviors or community norms in a setting with limited or no interaction, then our best choice is an environmental strategy. Again, we're not saying that youth-led programs can't implement alternative activities such as lock-ins or leadership conferences. Those are important things to do. However, alternative activities are not likely to cause a direct change in our selected outcomes. So alternative activities can be considered as value-adding activities, activities that support the youth-led program by helping to recruit new members or provide a drug-free space for members and their friends to socialize. Remember, the goal of youth-led programs in Ohio is to create community-level change, so we have to work with our young people to support them in that effort. In Ohio, we conceptualize youth-led programs as being grounded in 2 sources of evidence: the Youth Empowerment Conceptual Framework, or YECF, and the Strategic Prevention Framework, or SPIF. These are detailed in other adult ally learning opportunities, but it's important to remember that the concept of empowerment is core to the work we do as adult allies in Ohio. It's important to recall the definition of empowerment in this sense is the ability to influence the social and political systems that affect our lives. For this reason, it makes sense for young people involved in youth programs to focus on environmental strategies, as those types of strategies will result in young people developing a sense of empowerment as they exert their influence on their communities. This keeps us true to Ohio's goal of youth-led programs. Young people will collectively engage in a planning process to create and implement a strategic plan that uses evidence-based strategies to create community-level change. For this reason, this learning opportunity will focus on environmental strategies. So the question you may have is, so what's an environmental strategy anyway? Well, here's a great definition of environmental strategies. After reading the definition, please pause and jot down some ideas on how environmental strategies are related to developing a sense of empowerment, defined as the ability to influence social and political systems that affect our lives. The next question that typically comes is, what types of environmental strategies exist? For years in Ohio, the acronym CAMP has been used to describe 4 types of environmental strategies: community norms campaign, access and availability, media messaging, sometimes called social marketing, and policy enforcement and advocacy. Now, while the CAMP acronym is catchy, it's best to learn them in another order. So we'll start with access and availability. By definition, access and availability is the amount of time, energy, and money that must be expended to obtain a substance, alcohol, tobacco, or drugs. The more resources it takes, the harder it is to get the substance, the less availability, which is access. Of course, by resources, we don't necessarily mean monetary resource. There can be a considerable effort involved in obtaining a substance. Think about obtaining a fake ID, traveling to a town where no one knows you, lying to those who care about you, as also being resources that people have to invest in order to get the substance that they're interested in. Take a moment to pause and think about your problem of practice and think about possibilities where access and availability could influence that intervening variable that your young people are interested in changing. Jot down some ideas that may help spark your next conversation with your young people. When we think about that definition of empowerment as being the ability to exert social and political influence, naturally policy enforcement and advocacy strategies also arise. We know that policy and advocacy strategies can control availability, support norms, and specify sanctions for violations. While young people aren't often in the position to maybe craft policy or enforce policy, they can certainly advocate, and that is a strategy. And so they can advocate at many levels, be it locally for a school board or maybe a Parks and Rec district, or they can advocate on the state or national level. It's also important to remember that enforcement of policy creates that lasting change. So if policies are changed, there needs to be some enforcement. And that's where young people can also be involved in education of those who are in positional authority to enforce about why this is important, why it's important to them, and they need to enforce those existing policies. Remember that we're not just talking about the capital P, as I have on the slide here, policy. Also think of procedures. It doesn't have to be a law, or it doesn't have to be a community standard. It's also just simple procedures that young people can influence. Next, we'll take a look at media messaging, which is sometimes called social marketing. There are a lot of different types of media campaigns, and I'm going to highlight them here for you. There are also websites so you can go back and take a look at these campaigns. The first media campaign that we'll discuss is passive social marketing. In a passive media campaign, the aim is for the priority audience to change a behavior. So we want them to stop doing something, or start doing something, or sustain something they're currently doing that is healthy. In a passive campaign, the idea that we must make healthy choices is marketed, but it doesn't make a specific request. Related to substance use, the Above the Influence campaign is one that is a good example of passive social marketing. When you see above the influence, you know that the influence could be like under the influence, above the influence. I know it has to do something with substance use, but it doesn't actually tell us what we need to do. But it definitely drives us to that website to say, hey, I'm curious, I want to learn more. I want to know what above the influence means. And once I get there, I can engage with that media campaign. And you think about the young people that you know and care about in your own life and know that, above the influence could be something on Instagram that they might click on that may explore further into that media message to get those specific things or information or skills that they need to change their behavior. The second type, by contrast, active social marketing, the aim is for the priority audience to adopt and sustain a specific behavior. In this case, the campaign is very explicit on what we either should do or should not do to be healthy. The example that we have here is the National Football League or NFL's Play 60 campaign. When we hear Play 60, we know that the NFL wants children and young people to be active or play for 60 minutes a day. So the message is very clear, and you can see that above the influence, again, it's a passive message. We're curious, we're interested, we go and find more information, whereas Play 60, we may be curious and go find more, but we know exactly what it is that we are intended, the messages that we're intended to receive. Buckle Up is another good example of active social marketing. A community norms campaign is a special type of media messaging. In this type of media messaging, the aim is for the priority audience to correct an existing misperception about a norm. Correcting the misperception leads to behavior change. So the example we have here is from Ohio, and its home is Prevention Action Alliance, and it's the We Are the Majority rally. We Are the Majority is a tagline to help assure that the majority of young people are not engaging in risky behaviors such as alcohol use, tobacco use, etc. The majority of Ohio young people are making good choices. And in that case, the community norms campaign is driven by data. You have to have the data that says, here is actually what's happening, and then your intervening variable would be a misperception. For example, for prescription drug use. Everyone's misusing prescription drugs. If I'm not misusing prescription drugs, I'm not doing the same as my peers. So we put out a message, well, we are the majority. The majority of young people are not misusing prescription drugs. Then what that does is it helps people shift their perception about a norm and reinforce the good choice not to use prescription drugs, if that's what you're doing. Or if you are, then you could say, well, maybe not everyone is doing it, and maybe I don't need to do that either, or if I'm considering it. So community norms campaign is a media campaign, and that's the C. However, it's very special because it's data driven, and its aim is to correct an existing misperception about a norm. So listening to this, particularly if you've been trained in prevention, either SAPS training or some other prevention 101, you may be left with this question. How is media messaging different from information dissemination? Well, in information dissemination, the aim is to educate the public using mass media and marketing techniques, but it doesn't direct a behavior change. So some examples of information dissemination might be literature on the signs and symptoms of drug abuse. It might be facts about specific drugs. And I have a website there so you can see what some of those fact sheets are. In this case, it's the effects of alcohol on our brain and bodies. So it's designed to maybe help influence a decision, but the actual campaign doesn't direct what people should do or should not do. Oftentimes, media campaigns, such as Above the Influence, which again is a campaign designed to reduce drug use, is supported by information dissemination, such as what to do if you think you or a friend or family member might be using substances, or, for example, what are the effects of substances on my brain and body. So information dissemination oftentimes supports a media campaign, but again, that information dissemination piece doesn't specifically direct that behavior change. Thank you for participating in today's learning opportunity on environmental strategies. We like to think of the CAMP strategies as part of an environmental strategy toolkit. Once your young people have identified a strategy that is a good match for the logic chain the fun begins, you can begin searching for the right approach within the strategies to implement. The online environment is a great place to start. Depending on your problem of practice, sometimes called a prevention priority, there is a wealth of information on what is being done across the country or even across the state to address the intervening variables that are at work in your community. Because the actual approaches are dependent on your problem of practice, we can't provide a list of strategies to choose from, but what we can do is provide resources. Ohio's Fifth PFS website has a lot of good resources for selecting approaches within the environmental strategies that are grounded in evidence. We invite you to take a look here as you begin your journey at selecting a strategy that is grounded in evidence, culturally relevant, and sustainable in your community. On behalf of Ohio's Adult Allies and Training and Technical Assistance team, thank you for being one of Ohio's Adult Allies. The work you're doing with Ohio's young people is hard, important work. This concludes today's learning opportunity.